To speak to Caroline Murgor, who is the National Coordinator in Matters FGM at the United Nations Population Fund. Good morning, Caroline. And at this time of COVID-19, why would one care about gender-based violence?
Well, good morning, Sam, and it's good to be here this morning. Well, for COVID-19, as with any other pandemic, where we see movement is restricted, people are confined, and we also see that protection systems are slowly weakening. Women and girls are at greater risk of experiencing gender-based violence, and not only gender-based violence, but also the threat of harmful cultural practices and child marriage. The other factors during such a pandemic that drive gender-based violence include inequalities such as gender, age, disability, and this places women and girls at a greater risk. This means, therefore, that the women and girls or survivors of gender-based violence need prevention, risk mitigation, as well as response services. Okay. However, in times of like this pandemic, where we find that the services are required, we see that these services are reduced because resources are being diverted to respond to the overall health crisis.
Right, and that's interesting that you said that. But just before we get into the other areas, just concerned, when you look at the pandemic, it's been since December 2019 until now. When you look at the global trends, what are you seeing in terms of gender-based violence and the relationship? Have they gone high? Yes, you said that pandemically you have seen trends of this going high, but have you observed it so far? Well, one thing we have to understand, Trevor, and there's a lot of information, Sam, a lot of information that is out there, is that the GBV cases are on the rise. And these are from reports that we're receiving from grassroots organizations and various grassroots organizations. But one thing that is important to understand is that when it comes to GBV, especially in moments of crisis, is that we never wait for data to respond. Mm-hmm. One important factor here is that the absence of data does not mean that GBV is not happening. Mm-hmm. And yes, we agree that data is very critical to strengthening programming and as well as informing policy. Mm-hmm. But it is not a prerequisite for response. And that this means, therefore, that GBV in most instances happens in private spaces and may not always be reported. And especially now when we look at the curfew issue, mm-hmm. Reporting of GBV cases might not come out very clearly. And when we look at globally and also emergencies all over the world, it's been documented that emergencies aggravate existing inequalities and also deepen the vulnerability to violence. And this we can see clearly in our own experience during the 2007-2008 post-election violence, right, where a lot of GBV cases were elaborated very well within the WACI report. Mm-hmm. Another important component to understand is that, like, for example, when you look at the Ebola crisis in West Africa and also the drought and flood in our own countries, data clearly shows that GBV increases in times of emergency, and this pandemic of COVID-19 is not an exception as well. It's not an exception. Of course, it's very interesting because currently, Caroline, of course, many Kenyans are looking at the impact, the direct impact that is affecting them, whether it's economic or they have lost their livelihood, and so many other cases that are around protecting yourself from this virus. But when you look at all this, then what defines that gender-based violence? Of course, people are stressed, but what defines it? Are they set up, especially domestically?
Okay. One of the things that we have to understand, and especially on the issues of triggers, especially of domestic violence, as you're asking, we see that research points to very many causes of domestic violence. And of importance is that all these causes and risk factors have one thing in common, and that is the power relations between men and women. Mm-hmm. The power imbalance, as we have seen, is aggravated by the nationwide curfew that we have currently. Mm-hmm. And where if you have been oppressed or repressed, you suddenly find yourself in a confined space with an abuser. Mm-hmm. So this situation alone exposes survivors not only to psychosocial violence, mm-hmm. and also they are exposed to psychosocial violence even before they experience whether it's physical, sexual, or economic violence. So mm-hmm. there are many triggers, but the most common factor here is the power relation between men and women.
Okay, and of course, I recently heard from the judiciary saying that 30% of criminal cases that are being reported, 30% of them are related to sexual offenses. So when you look at situations like this, as UNFPA, I mean, yes, how do you respond in such crisis?
Yeah. Okay, well, what we have done as an agency, and most important, because one of our when you look at our transformative result areas, we actually focus on three main zeros. One of the zeros is on ending maternal deaths. The second zero, and most important, is on meeting unmet need for family planning. And the third, most important and critical one that we're discussing today is ending gender-based violence and harmful practices. So in this crisis, what UNFPA has done is to reprogram our interventions so that we are able to integrate advocacy, protection, as well as response mechanism to ensure that violence against women and girls are prevented and that access to these services are in place. What we are also doing is working closely with both the national and county governments to ensure that the community-based protection systems are still effective to protect women and girls from gender-based violence, and also looking at the girls who are at risk of female genital mutilation and child marriage. But most important, that as an agency and where we are giving our support, is we're ensuring that we provide the technical support to be able to mainstream GBV in all aspects of the COVID-19 response. This means then making sure that GBV is mainstreamed in national contingency and preparedness plans. And we are also working very closely with the partners as well as the government of Kenya to ensure that these services as well are survivor-centered. It is very important that the survivor is put at the center when you're responding to issues of gender-based violence. And this simply means scaling up service delivery for case management and looking also at psychosocial support. And we also have, as the doctor has mentioned, the professor from the hospital has mentioned, in terms of training of personnel, whether it's healthcare personnel or responders at the community level, to be able to respond appropriately to issues of gender-based violence. And also we have ensuring quality of care when it comes to survivors of GBV.
And of course,
maybe I should mention the other most important,
just before you do that, as we conclude this, Caroline, of course, earlier on in our conversation, you had indicated that at such times it's even difficult for people to reach out to you. I don't know, right now, if there's a victim of GBV, how are they supposed to seek help, whether to you directly or other institutions?
Well, currently the government has put in place, we have the national GBV hotline, the 1195, which is under the State Department for Gender. As an agency, we are providing support to ensure that that we strengthen the response capacity of this national hotline. And where these hotlines are able to, if anyone calls, it's a toll-free line. And when they call in, they're able to access psychosocial support, and they're also able to be referred to appropriate care. And we've had situations of where when a survivor calls and they're not in a position to be able to get to a health facility, then we have ambulances on standby by the Kenya Red Cross and MSF, and the hotline is able to refer and have the ambulances go and pick the survivor so that they can be able to access the appropriate services that they require. And also most important is that these hotlines as well strengthen the referral pathways. And they also share information not only on GBV prevention and response, but they're also sharing information in relation to protection against the COVID-19.